There's a new report out that confirms what many of us already suspect. Mass shootings here in the United States are on the rise. Why is that, and can we turn the tide? We're going to talk to an expert about both of those questions. Joining us now for a closer look is the psychiatrist-in-chief at the Institute of Living at Hartford Hospital, Dr. Hank Schwartz. Thank you so much.
Thank you for having me.
So what is happening here?
I think we're seeing a contagion effect now in which the acting out of bizarre and terrible behavior has an effect on other people who are prone to act that way, and it disinhibits them. And so we see an increasing rate of these violent shooting episodes. You know, for decades we've seen that with adolescents in high school and junior high school attempting or talking about suicide, and one suicide has the tendency to propel additional suicides. I think we're seeing that with mass shootings.
And what is the personality that would actually do this and take action?
By and large, the people who commit mass shootings are young men who are very alienated, isolated, angry, paranoid, believing that if they act out something that will help them to achieve some kind of status that they haven't had before. They're grievance collectors. The world has treated them poorly, and they're going to show us and prove their position through some terrible act.
So what can we as a society do? Can we turn the tide?
Well, that is a very, very complicated question. We have to remember that the single common denominator between all mass shootings is shooting. Guns. The availability of guns is a very, very huge problem in terms of any prospect of containing mass shootings without doing something to control availability. Imagine a country that is having difficulty increasing even the effectiveness of background checks to keep guns out of the hands of mentally unstable, mentally ill individuals and folks with criminal histories.
What else? Are there signs, are there symptoms that we could recognize?
Sure. 50% or so of individuals who commit mass shootings do have a diagnosable mental illness, and most of the rest, certainly if not formally mentally ill, are not mentally well. We have a fractionated mental health system in America. We don't expend enough resources on early intervention, on addressing the very, very beginning of mental illness in people while they're young, while the illness still has a chance of being turned around. The most effective way to prevent somebody from becoming mentally ill and then acting in this kind of way is to treat the mental illness effectively.
You talk a lot about learning empathy in your presentations. Can you talk a little about that?
I think one common denominator behind all of these shootings, you know, if you think about it, the mentally ill really are not responsible for a disproportionate amount of violence in America. So what is it that characterizes the individual who does shoot, whether it be out of a mental illness, whether it be out of a religious motivation, whether it be out of hatred? I believe that it is a lack of empathic connectedness to others. And empathy and empathic connectedness is something that we can detect. We detect it early in elementary school and later when kids bully. And we can address that kind of behavior through social emotional learning programs that are quite effective if we engage in them.
Yes. Interesting. Dr. Hank Schwartz, psychiatrist-in-chief at Hartford Hospital's Institute of Living. Thank you.
Thank you.